Let's start with the COVID relief bill. First of all, pertaining to your constituents, how they are holding up against the virus, and is there room for any debate within this bill?
Well, good morning, Mika. You know, what we've seen here in Illinois is rising number of cases. Obviously, in the last few weeks, they've decreased. The number of deaths have decreased, and that's a welcome change. But we know that we are not on a path towards economic recovery unless we crush this virus. So that is the priority in this COVID package. But I welcome the news of this type of family-related stimulus. We know that our families need economic relief. When we look at the toll that the COVID virus has taken on our local economies, we know that so many families have been struggling to make ends meet, to pay their bills, and to, recover. And so I think that this is a welcome.
Congresswoman Underwood, Al Sharpton, you represent a district that clearly you are a rising star nationally, well, a risen star nationally, but clearly you have had a heart for the district. And we've seen a disproportionate impact on people of color in this pandemic. How important is this relief bill, particularly to people that you represent in Congress and people that have been not only hit, but hit the hardest during this pandemic?
Well, the data is very clear that Black and brown communities have been disproportionately impacted. We're more likely to be essential workers, frontline workers, and as a result, more likely to be diagnosed with COVID-19 and more likely to die. And so in this relief package, we will be able to get advancements in data disaggregation. Only half of states are publicly reporting their COVID diagnoses and death data, and certainly not stratifying by race and ethnicity. This is an important step forward. Also, pregnancy status, right? An important step forward. That will be in the package. I'm also very pleased to hear about the Biden administration's plans for vaccine distribution targeting those communities that have been most directly impacted. We need to be flooding the zone in these communities. And so when we hear them talk about equity, that's what this means, making sure that the people who are experiencing the disproportionate impacts of COVID-19 are able to get access to this vaccine.
Representative Underwood, I want to ask you about the Momnibus Act. You're working on an issue that actually has been a huge issue for years now. What does it do? Who are you trying to help?
Well, in the United States, Black women are 3 to 4 times more likely to die of a pregnancy-related cause than white women. This is a disparity that has been around my entire lifetime, and I'm 34 years old. And so last year, we introduced a comprehensive, large bill called the Black Maternal Health Momnibus Act with Congresswoman Alma Adams of North Carolina and then Senator Kamala Harris to address this disparity. We know that there are solutions, whether we're talking about increasing the perinatal workforce or making key investments to address social determinants of health like housing and nutrition and transportation. Well, we're reintroducing that legislation today. We have a new partner in Senator Cory Booker, and we've expanded the Momnibus from 9 bills to 12. If you can imagine, 12 bills on this one issue. We've included provisions to address climate change and 2 bills explicitly to deal with the impacts of COVID-19. We've seen a real gap in information for pregnant and lactating and postpartum women related to vaccine. We've seen a real gap in the participation in these clinical trials, and we've seen a disparity. When pregnant women of color get diagnosed with COVID-19, they have far worse health outcomes than white women. And we can save lives. We can make a real impact on communities, and we can help all women by targeting these investments and these, policy interventions. And I'm really excited about the bipartisan support that we've gotten so far.
And Representative Underwood, before you go, we're asking all of our guests for Black History Month to talk about a Black American that you want to put a frame around, and you've picked Shalon Irving. How do you know her, and why have you chosen her?
Dr. Shalon Irving was my friend from graduate school at Johns Hopkins University. She was a brilliant epidemiologist who worked at the Centers for Disease Control and Prevention, dedicated her life to ending health disparities. And when she was expecting her first child, Soleil, in 2017, she died 3 weeks after childbirth. And this is a woman who did everything right. Had health care, was highly educated, had employment, right? Went to all of her appointments, and still we lost her. And so she is what really motivated, her death is what motivated me to do this work in the Congress. And I am so honored to be able to recognize her incredible life, her contributions to the public health sciences, and to lift up her story today in honor of Black History Month.
Congresswoman Lauren Underwood, thank you. Thank you very, very much for being on this morning. And still ahead, the highly contagious UK strain.